A simple side foot soccer kick is used for short and accurate passes, which involves the hip, the knee, and the ankle joints, with the non-dominant leg acting as a motion stabilizer and the dominant leg as a kicking leg. This movement has 4 phase components: the stance phase, the cocking phase, the acceleration phase, and the follow-through. For this project, the preparation, backswing, and leg cocking phases are incorporated into one as the cocking phase. During the stance phase, the dominant leg is in 45-degree hip flexion and the 10 degrees knee flexion, and the ankle is neutral to slightly dorsiflexed and inverted. The non-dominant leg is in 30 degrees hip extension and slightly externally rotated. The knee is fully extended and the ankle is slightly dorsiflexed. During the cocking phase, the dominant leg is in 20 to 30 degree hip flexion, 10 degrees abduction, and externally rotated. The knee is in 80 degrees flexion and externally rotated, and the ankle is in slightly plantar flexion. The non-dominant leg is in 45-degree flexion, 10-degree knee flexion, and the ankle is in dorsiflexion and inversion. During the acceleration phase, the dominant leg is in 30-degree hip flexion, externally rotated, and 20 degrees hip abducted. The knee is in 80-degree flexion and the ankle is in dorsiflexion. The non-dominant leg is in 45-degree hip flexion. The knee is flexed and the ankle is in dorsiflexion. During the follow-through phase, the dominant leg has a hip flexed to about 80 to 90 degrees, 90 degrees knee flexion, and the ankle dorsiflexed and inverted. The non-dominant leg has a hip and knee slightly flexed with the ankle remaining in dorsiflexion and planted to the field. The primary muscle movers in the hip involve the iliopsoas, gracilis, TFL, gluteus medius, gluteus maximus, sartorius, rectus femoris, biceps femoris. For the knee, the popliteus, semimembranosus, and semitendinosus are the primary movers. And for the ankle, the tibialis anterior, peroneus longus, and peroneus brevis are the primary movers. The velocity of the ball will be affected by 2 actions. The first is the type of kick chosen, a side foot kick or an instep kick, and the velocity of the leg during the cocking phase. Studies have shown that the ball will have a faster velocity when using an instep kick versus a side foot kick. The velocity at which to kick the ball with is also tricky, as you don't want to kick it too slowly, as it can cause the pass to not get to your teammate on time before the opponent interferes. Kicking too fast, however, will also make it difficult for your teammate to control the ball and continue the play. The position of the foot during the kick will also affect which muscles are activated to perform the movement and the outcome of the kick as well. If the leg is not abducted enough, there is potential for the ball to be hit incorrectly and missing your aim. There's also the potential that the heel can hit the inside of the ankle in the stabilizing leg. Foot placement is also very important. If the non-dominant foot is in front of the ball, it can cause balance when trying to perform the kick. Make sure to also point the toes in the direction you want to kick to ensure accuracy or to improve your accuracy in a kick. In the ideal movement, we would have the player keep his or her body loose and not too tight, and have the planted foot not be too close to the ball, as this will cause the player to be off-centered and lose balance during the follow-through phase. It is also important to note again that the athlete should always maintain their toes pointed in the direction of their teammate or whoever they want to complete the pass to, as this will ensure accuracy in the pass.